Parkinson's is something that we think of as someone having a tremor, shaking. But 1/3 of people who have Parkinson's have no tremor and don't shake. So being able to make a diagnosis of what Parkinson's is something that takes a multidisciplinary team.
We started this clinic 12 years ago to provide multidiscipline care for the Parkinson patient because they have both motor and non-motor features.
It's a game changer for many people. But that's just it, it's a game changer. There are changes that we can make and continue to make to help people function well in their lives, to help people keep working, to help people keep enjoying their community activities.
I think the strengths of the program is that we have 3 physicians that specifically see and treat patients with movement disorders. Dr. Newman has many years' experience treating patients mainly with Parkinson's disease. Dr. Pickett has a lot of experience with research and treating patients with some novel therapies. And I am more recently out of fellowship trained, and I do Botox treatment for a lot of movement disorders, as well as DBS surgery and programming for Parkinson's disease and essential tremor.
We have people on our team who are physical therapists. We have speech therapists who can work with people through all the different stages of their disease.
Our therapists are experienced and trained in some of the specific treatment protocols for Parkinson's disease that I don't see being used by the patients who come from other therapists.
We often think of Parkinson's as being a malady that afflicts older people, but 1/10 of the people who have Parkinson's are under 40 years of age.
There's just this natural tendency in our culture that as you age, the less you're going to be able to do. And so some older patients with Parkinson's, I don't think have as much of a feeling of disability as someone with the same symptoms who's 30 or 40 years old. And so I think the emotional and the psychological impact of having Parkinson's disease at that age as opposed to someone who's in their 70s, it's night and day.
We have a psychiatrist who comes in 1 day a week to provide psychiatric services, which is somewhat unique even for Parkinson Center. We have a neurosurgeon and his team of people. So altogether we probably have 20 people who are providing care for the Parkinson patient.
We're in this together. We share it and we help people carry it. And I think that's key. It's something that has to happen in a very personalized, precise way.
When a patient has been unable to feed themselves or to write a checkout or even to write their name, and then for the first time they can grab a pen and they can write their name and they can hold a cup and they're no longer relying on people around them. And that's the most success I feel in my job, is when I see that and can share that with a patient.